Hello, I'm Dr. Mark Gittleman from Uromedics 21C and Optimal Health Miami. And today we will be reviewing the instructions for penile injection therapy. Penile injection therapy has been used since the time it was introduced to the urology community in the mid-1980s. To produce an erection, the nervous system, blood vessels, and hormones all have to work together. The penis is made up of spongy tissue filled with blood vessels. When a man becomes sexually stimulated, the blood vessels relax and expand. This brings more blood to the penis. The tissue then swells and the penis becomes hard enough for sexual relations. The blood is released after orgasm, allowing detumescence of the penis. The consent form which we have had you sign reviews some of the inherent risks of the therapy. This video is designed to help you with the actual technique. In the office, we will review in great detail how to do the injection, and we will demonstrate an injection. We want you to be sure you understand exactly what to do before your first injection. You can always come back to the office for further instruction, but this instructional video might be helpful to review some of the key instructions that you should be following. First, wash your hands with soap and water. Take the medication out of the refrigerator and prepare a clean space to place the medication and your insulin needle and alcohol swabs. Cleanse the top of the bottle with an alcohol swab. Then uncap the insulin needle. Some insulin needles have a cap on the bottom as well, so if it does, please uncap the bottom. Turn the bottle upside down and pierce the rubber top of the bottle in the center. The label often obscures the view of the liquid solution, and if that's the case, rotate the bottle so you can see the needle in the liquid. Then extract only the dose that has been directed for you by your physician. You can then either recap the needle or place it on a flat surface in a way that the needle does not touch the surface at all. Now, sit, stand, or lie down so that you're in a position that allows you to view your penis in its entirety. Some men benefit from the use of a mirror. Some men prefer their partner does the injection, and that's fine as long as they're knowledgeable about how to do the injection. Place the penis on stretch by pulling with 2 or 3 fingers from the glans, the head of the penis. The penis should be pulled out in a way that does not twist the penis at all. Do not use other fingers to support the penis, only the 2 or 3 fingers that are doing the stretch. If you're uncircumcised, retract the foreskin so that when you stretch the penis, it's only the glands being pulled and not the skin. The injection is to be done on either the left side or the right side of the penis. Do not inject on the top, on the bottom, or on the head of the penis. Now, choose a location that's mid-shaft or a bit closer to the base of the penis, that is closer to your body. And try to choose an area that has no visible veins. Then clean the area with a fresh alcohol pad. Uncap the needle and hold the syringe with 2 fingers and a thumb as though it were a dart. Inject the side so that the syringe is at a 90-degree angle with the shaft. The full length of the needle needs to be inserted into the penis. Now you can move your thumb up to the plunger of the needle and inject the full contents of the syringe into the penis. Be sure not to push too hard on the syringe when you push the plunger so that you don't wind up pushing the needle too far into the penis. Remove the syringe and place it into a safe biological container. Place the alcohol pad in the area just injected and place pressure on the penis with 2 fingers on opposite sides of the penis. Be sure that you're applying the pressure to the fleshy part of the penis, not just the skin side of the injection, and apply the pressure for roughly 5 minutes. This helps to disperse the medication and to prevent bruising. I have a few additional tips to help you. It may be easier to inject if you begin the process after some foreplay, as this may allow some increased blood flow to the penis and it makes the injection process a little easier. Try to alternate the exact site of the injection. Never do an injection within 3 days of Viagra, Cialis, Levitra, Staxin, or Stendra. Those are the 5 different brands of oral medications to help improve erections. And again, never take a Viagra cells on the same day as injection. Again, we want to make that 3 days. Do not increase the dose above whatever range was prescribed by your doctor. If the medication is not working or stops working, call your doctor. And please discard the medication at the expiration date, regardless of whether there's additional medicine in the vial. It may seem like a waste, but we want to keep you safe by adhering to expiration rules. We want to be confident that the medication stays sterile. After all, you're injecting a very important part of your body, so this advice is for your protection. And it's best to not inject 2 days in a row. Although the medication may work on its own, it's best to resume or begin sexual activity to help increase arousal and blood flow. Efficacy should be evident within 10 to 20 minutes. Now, if your erection lasts more than 3 hours, please go to the emergency room. If you have a priapism reversal kit, please follow the instructions that came with that kit. If that doesn't bring the erection down, it's essential to go to the emergency room immediately for further evaluation and treatment. I hope this video has been helpful for you. We know that the more comfortable you are with your program, the more likely you are to adhere to the program we've designed for you, and in turn, more likely to reach your personal health goals.